Pierre Morgan from Life Science News. Today we bring you the breaking news on an outbreak that caused concern in southern Bhutan. Health officials has confirmed the case of Giardia, a parasitic infection that is spreading in southern Bhutan, particularly at Phuentsholing and Gelefeu. Giardia is a microscopic parasite that causes illness known as giardiasis. It is commonly found in contaminated food and water, and it can be spread easily where there is poor sanitation and hygienic practice. We have residents from affected areas in Gelefeu and Phuentsholing sharing their experience.
कुनै सर यो भुँडी दुख्ने र डाइराले साह्रो पारे सर 2-3 दिन भइसक्यो कुनै
As per Ram, a resident of Gelefeu Trombe, he claims that maybe the outbreak is due to consumption of contaminated food and water.
After I was infected, I had a sleepless night and I had the symptoms like diarrhea and vomiting. I could not afford to go to work for a long time and I have been struggling for a week.
Health expert Dr. Som Choden of Gelefeu Hospital is here in line to share her findings on the Giardia infection.
Good evening, I am Dr. Sonam Choden, specializing in infectious disease at Gelefeu Hospital. Today, I'd like to discuss a public health concern, which is the recent outbreak of Giardia at Gelefeu and Phuentsholing. Giardiasis is a common enteric infection caused by the protozoan Giardia lamblia, also known as Giardia duodenalis or Giardia intestinalis. Transmission usually occurs via the fecal-oral route when traveling. Giardia species infects mice, amphibians, and birds. And the most common species is Giardia duodenalis, which has a wide mammalian host range. Now, to explain the routes of transmission, it includes waterborne, foodborne, and fecal-oral transmission. The signs and symptoms include diarrhea, watery and smelly stool. It also includes abdominal cramps, distension, flatulence, eructation, nausea, vomiting, anorexia, weight loss, and dehydration. Transmission can include the ingestion of cis-contaminated species and also include animal overcrowding. Transmission can also be possible if the untreated water is consumed while camping, hiking, or even if a small amount of water is ingested accidentally while swimming. If transmitted, symptoms show after 1 to 2 weeks, and symptoms include diarrhea, cramps, nausea, flatulence, and greasy stool. You can ensure that water is free of Giardia infestation by following these 3 methods, which includes 1. Filter with less than 1 micrometer pour. 2. Fully boil the water for at least 1 minute. 3. Treat water with chlorine or iodine. So the treatment, if I explain in simple terms, it includes antimicrobial therapy, which is important. The antimicrobial therapy includes metronidazole or other azoles, and supportive care with fluid and electrolyte correction from diarrhea. Treatment is only indicated in asymptomatic individuals to reduce transmission to high-risk groups such as daycare centers, immunosuppressed, and pregnant individuals. The complications of giardiasis include dehydration, persistent or recurrent symptoms, and it also includes rare complications such as reactive arthritis, irritable bowel syndrome, and lactose intolerance. Prevention is the key for giardiasis. It includes appropriate public water treatment, hygienic food preparation, appropriate fecal-oral hygiene, and you need to avoid or purify water when camping and hiking if possible. Adequate nutrition is necessary. For example, you can add a protective factor in resource limiting settings such as zinc and vitamin A.
Yes, thank you, Dr. Som Choden, for your insightful knowledge and concern to the general public. For more information, we have Professor Chetan Gelson from Yale University to share about epidemiology and other concerns related to the disease. Before contacting the professor, let me share a brief profile of him. He is qualified from Yale University 15 years ago, and he is serving as a professor in Yale University, and he is renowned in a field of parasitology in Europe and America. Hello, professor. Do you hear me? Hello.
Hello. Yes, it's audible. So, first of all, thank you for providing me with this opportunity. So, let me now explain a detailed information about the Giardia. Epidemiology of Giardia, widespread throughout the world, affects 200 to 300 million people per year, more common in areas with poor sanitary conditions and limited water treatment facilities. The risk factors of Giardia includes being a child, they are more in contact with the feces. Number 2, working with the children. Number 3, lack of access to safe drinking water. Number 4, unprotected anal sex. Number 5 is living in endemic areas. Number 6, being a traveler. And number 7, immunocompromise. Example, a patient who had an organ transplant. Let us talk about the pathogen itself and its life cycle. So, Giardia species exist in two forms, the cyst and the trophozoites. The cysts are the infectious form of Giardia and excreted in stool. They are able to survive in moist environments for a prolonged period before ingestion. Following cyst ingestion, for example, someone is playing with poop but they ingested it. Well then, the excitation occurs in the small intestine. This is where each cyst that was ingested produces two trophozoites, the other form of Giardia. Trophozoites are the binucleate flagellated parasitic form that reproduces through binary fission in the small intestine. The trophozoites replicate basically and they have this adhesive disc which attaches to the mucosal surface of duodenum and jejunum. And trophozoites that do not adhere are reverted to the infectious cyst formed in the large intestine. So, the cysts are then excreted in stool back into the environment and the cycle tends to continue. Cardio has an incubation period of a week before symptoms occur. Now, this is the 3D animated picture of Giardia. Giardia is a flagellated parasite that reproduces in the small intestine and causes giardiasis in the small intestine of a human being. So now let us talk about the morphology of the giardial cyst in brief. Giardial cysts are oval to ellipsoid in shape, one pole more rounded than the other. It measures up to 8 to 19 micrometers. Mature cysts have 4 nuclei, while the immature cysts have 2 nuclei. Nucleus and fibrils are visible in both iodine-stained wet mounds and trichome-stained smears. Fibrils are shiny, hair-like line folded in 2 or S-shape lengthwise in the center of the cyst. Shells often appears to be thick with double wall and second wall of membrane of cytoplasm. Cytoplasm are clear and shiny while unstained and appears to be pale yellowish green after staining with iodine solution. Next, we will talk about the pathogenicity of the Giardia. So, let me now explain the pathogenesis of Giardia. Giardia causes an increase in epithelial permeability, an increase in number and activations of T lymphocytes in the gut. This leads to shortening of brush-borne microvilli and causes a reduced absorption of water, electrolytes, and nutrients. Together with decreased activity of the small intestinal brush border enzymes, the host suffers from malabsorptive diarrhea and malnutrition. Reduced activity of lipase and increased production of mucin leads to mucus diarrhea and illness in the host. Clinical signs are often normal. However, Giardia infection in small animals may manifest as a chronic weight loss and chronic or intermittent diarrhea, particularly in the young. Feces appears soft, pale, smelly, and contains mucus and fats. Watery diarrhea is unusual and is not usually absorbed However, an animal may vomit. Differential diagnosis includes virtually all other causes of malabsorptions and maldigestion such as exocrine pancreatic insufficiency. In young ruminants, giardiasis can result in diarrhea unresponsive to antibiotics and coccidiostatin. It should be suspected when feces are meagre and pasty. In animals less than 6 months of age shall reduce weight gain. One of the most efficient ways to control Giardia infection is through management of production animals and good health domestic animals. Cysts can cause infections and reinfection, particularly if housing is crowded. Giardia cysts are immediately infective and pass into the feces and survive in an environment. Cysts are the source of infection and reinfection for animals, particularly in those crowded conditions. Feces should be removed from the environment daily. Dogs and cats should be bathed to remove cysts from their hair coat. Disinfections with chemical disinfectants and steam or boiling water can be used to inactivate the cyst in the environment. To facilitate the efficacy of the solution should be left for greater than 5 minutes before rinsing. Yards and animals' runs cannot be disinfected and should be considered contaminated for at least a month after removal of the last animal. Cysts can be also inactivated by allowing the surface to dry after thoroughly cleaning the house.
To understand more about Giardia, we have an analogy that explains the infection and transmission of Giardia.
The typical story for Giardia transmission is amongst travelers or campers who go to an area endemic to Giardia and drink unfiltered or unpurified water, likely from a stream or river. This water is contaminated by animal or possibly even human feces that contains cysts of Giardia. So technically, Giardia is transmitted by fecal-oral transmission. So let's add a poop floating in this river, causing the surrounding water to be poop-tinged. As I mentioned, it's the cysts that get transmitted fecal-orally. So to illustrate cysts, we'll use our recurring symbol of bubbles and have this stream bubbling right before this waterfall. As I just mentioned, the disease is often associated with camping and can infect people who don't purify their water before drinking it. So we'll give these people on the boat some backpacking backpacks to remind you of the association with campers and hikers. Looks like this guy on the boat has forgotten to purify his water and he's filling his bottle with the poop water. Again, this is illustrating that Giardia is transmitted through poorly purified drinking water. So what happens to these unfortunate people who get Giardia? What can they expect? Well, it causes bloating, flatulence, and foul-smelling diarrhea. And actually, you can remember all of these symptoms really easily by remembering how you feel after eating Taco Bell. Or we can throw in some memory cues for you. Like, we can draw some campers holding their noses to remind you of foul-smelling diarrhea, as opposed to the normal, beautiful-smelling diarrhea. An important buzzword that supports giardiasis is steatorrhea, which means fatty diarrhea. So to represent this, we'll draw a man sitting on a yellow stool. Yellow to remind you of fatty stool. And notice it's not red because it's not producing bloody stools. So the stools become fatty from fat malabsorption. And although the exact mechanism for fat malabsorption is unknown, it's proposed that Giardia stimulates excessive mucus production that impairs the absorptive capacity of the intestine. People with this infection who don't get treated can have significant weight loss and health problems from malabsorption. Do you remember what vitamin deficiencies might occur as a result of fat malabsorption? Right, that would be vitamins A, D, E, and K. Now, after you ingest this cyst form, it differentiates into the trophozoite form. They have a very distinctive look that you should be able to recognize. And here's one under scanning electron micrograph. Notice it's flagellated and has these ventral sucking discs that give it its really distinctive look. Now let's look back to the drawing at the side of the boat, to these shields that we're drawing. They have a very similar shape and are also flagellated, and you're likely to see a picture of Giardia that looks similar to these shields on your exams. So, if you remember these shields, you should be able to recognize it. The trophozoites attach but do not invade the intestinal wall, which is important because if it doesn't invade, it won't cause bloody diarrhea. unlike entamoeba and some of the other bacterial pathogens that we've talked about. The trophozoites can be passed into the stool, which is why some of the shields have fallen off into the water. And we have this man pointing at them, seeing them in the poop water, because finding these trophozoites in the stool is diagnostic. You'd find them if you ordered a stool O&P, or ova and parasites. So we'll write OP on his shirt to remind you of this diagnostic test. Also, some of the trophozoites in the intestine will turn back into the cyst form and also show up on stool O&P, and those are what go and infect other people. Alternatively, you can perform an ELISA stool antigen test to make the diagnosis. So we'll actually title the boat ELISA, a great boat name. Interesting story, I came really close to naming my boat ELISA, but then realized I couldn't because I don't have a boat. Also, remember the boat is floating in the diarrhea water to remind you that the ELISA is looking for stool antigens. Do any of you out there know how we treat giardiasis? Well, the answer lies in Disneyland, if you've been. Guess what passes just behind the Jungle Cruise? A monorail, which happens to be our symbol for metronidazole. So we'll draw this monorail or metro here to remind you of metronidazole. Isn't it just amazing how these symbols work out? So this brings us to the end of our jungle ride. I hope you had a nice tour of the Giardia jungle. And remember to pack yourself plenty of clean water for your hikes, or they may turn into runs.
The diagnosis of Giardia infection or the giardiasis typically involves examining stool samples for the presence of Giardia cyst or trophozoites using microscopy, antigen detection test, or PCR testing. Multiple stool samples may be required due to intermittent shedding of the parasite. Serological tests detecting antibodies against Giardia are less common. Clinical presentations such as diarrhea, abdominal pain, and weight loss, along with a history of exposure to contaminated water and food, can also aid in diagnosis. Early and accurate diagnosis is crucial for prompt treatment and prevention of the spread of the infection. Are urging residents to remain vigilant and to take a necessary precaution to prevent further spread of this infection. If you believe you or someone you know may have been exposed to Giardia or are experiencing symptoms, please contact your local health department and healthcare provider for guidance. Before winding our session, we have some questions for the day. For those who answer it correctly, we have kept attractive prizes.